Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
medical negligence or professional negligence. This is negligence of a doctor. Absence of reasonable care or skill is act of omission. Willful negligence is act of commission. On the part of doctor while treating the death on part of the doctor while treating the patient, if while treating the patient the doctor may cause damage or death to the patient, then that is medical negligence or professional negligence. According to Black's Law Dictionary, patient has to prove the 4 D's of medical negligence. 1. Duty. In duty, doctor patient relationship should be established. Dereliction of duty. This is departure from the normal practice, is dereliction of duty. Direct causation. In direct causation, dereliction of the duty should be the direct causation for the damage of the patient. So the work that the doctor has done should result in damage to the patient. 4. Damage. Damage should be measured and it should be compensated by damages. That is, you can either give compensation or money should be given for the damage that has occurred. Types of professional negligence. Two types of professional negligence: civil negligence and criminal negligence.
thank you and thank you for watching.